Hey everyone, welcome back to our channel. Today, we're diving into a topic that might seem a little daunting, but is incredibly important for raising awareness: the top 5 untreatable eye diseases. Now, don't let the word untreatable scare you too much. These conditions are rare, but knowing about them can make a huge difference in early detection and management. So, let's get into it. Retinitis pigmentosa, the tunnel vision thief. Imagine looking at the world through a tunnel, with your peripheral vision slowly fading away. That's what people with retinitis pigmentosa experience. This genetic disorder affects the retina, the light-sensitive tissue at the back of your eye, leading to a gradual loss of vision. What makes RP particularly tricky is its slow, progressive nature. It can take years or even decades to fully manifest. Retinitis pigmentosa is untreatable, meaning there's no cure yet, but there are ways to manage it. Researchers are also exploring gene therapy and retinal implants as potential future treatments, so there's hope on the horizon. Stargard disease, the juvenile macular degeneration. Stargard disease might sound like something out of a sci-fi movie, but it's actually a form of juvenile macular degeneration. This condition typically starts in childhood or adolescence and primarily affects the macula, the part of the retina responsible for sharp central vision. As the disease progresses, people with Stargardt disease often find it difficult to read, recognize faces, or see fine details. It's a genetic condition caused by mutations in the ABCA4 gene, which leads to the accumulation of toxic substances in the retina, ultimately damaging the macula. Stargardt disease is currently untreatable, but let's not forget, researchers are hard at work, with gene therapy and stem cell research offering promising avenues for future treatments. Libras hereditary optic neuropathy, the sudden blindness striker. Libras hereditary optic neuropathy is one of the most sudden and shocking eye diseases out there. It typically affects young adults, usually males in their late teens or early 20s, and leads to rapid, painless vision loss in both eyes over a few weeks or months. This disease is caused by mutations in the mitochondrial DNA, which are inherited maternally. This disease primarily affects the optic nerve, which is crucial for transmitting visual information from the eye to the brain. Once the optic nerve is damaged, vision loss is usually permanent. Currently, this disease remains untreatable, but there's ongoing research into gene therapy and mitochondrial replacement techniques that may one day offer hope to those affected. Usher syndrome, the dual sensory loss. Imagine living in a world where you're gradually losing both your sight and hearing. That's the reality for people with Usher syndrome, a genetic disorder that leads to both vision and hearing loss. There are 3 types of Usher syndrome, with type 1 being the most severe, often resulting in complete blindness and profound deafness. Usher syndrome is particularly challenging because it affects 2 senses simultaneously, making daily life incredibly difficult. The vision loss associated typically starts in childhood, while hearing loss can be present from birth or develop over time. Unfortunately, there's currently no cure for Usher syndrome. However, cochlear implants and hearing aids can assist with hearing loss, while low vision aids and mobility training can help manage vision loss. Last but not least, macular degeneration. Macular degeneration, particularly age-related macular degeneration, AMD, is a leading cause of vision loss among older adults. It affects the macula, the central part of the retina responsible for sharp, central vision. AMD primarily comes in 2 forms: dry, atrophic, and wet, exudative. In dry AMD, there is a gradual thinning of the macula and the accumulation of drusen, yellowish deposits, beneath the retina. This can lead to blurry or dim central vision, difficulty recognizing faces or reading, and a gradual loss of central vision. Wet AMD involves the growth of abnormal blood vessels under the retina that can leak fluid and blood, leading to rapid vision loss. Regular eye exams are crucial for early detection and treatment, which can help preserve vision and prevent severe vision loss. While macular degeneration is currently not curable, but working closely with an eye care professional is essential to managing the disease effectively and preserving vision. So, there you have it. 5 of the most challenging and currently untreatable eye diseases. But remember, untreatable doesn't mean hopeless. The key is awareness, early detection, and staying informed about the latest developments in eye health.
If you find this information helpful, please hit the like button and subscribe to our channel for more informative content.